Oh, no.
We are on the air. We're just having a conversation here. We have a very hot topic to start the show with. My name is Rebecca Rainier, and just like the song says, this is Full Plate, and I'm so glad you're here. Joining me today is Dr. Craig Colville and two people that are going to help us kind of get through this topic, because it's sensitive in that it's like a female thing, but it's really good information. So we're going to talk about what's the procedure that you know, it's kind of a hot topic right now.
So Rebecca, the topic really is non-surgical vaginal rejuvenation.
Okay.
It's a very big topic in plastic surgery.
And why is it newish, or is it something that people haven't talked about before? Or
I would describe it as newer.
Okay.
The advantages and the advances are because it's non-surgical. You don't have to be asleep. You can do it in the office. It's not uncomfortable. There's no downtime.
So there are a lot of advantages to this. Joining me also today is Leslie Eel, RN, right here. And we have Joy McCarris. I can't say it. You are a
esthetician.
Now, I know the word, but just can't say it. And I've moved on. I'm old enough to know things I can't do. And say esthetician is kind of, it's a crapshoot. All right, so Dr. Colville, so it's a new-ish procedure. Who is the perfect candidate for this procedure?
This is a procedure that's mostly for women after they've experienced childbirth or with aging.
Or with aging. Hormonal changes, can that also be
Yes.
a reason that you might consider it?
Yes.
And when you're talking about it's an inpatient, your outpatient thing, it's not a huge chunk out of your life to have this done.
This is done in the privacy of our spa, actually. It's done by Leslie and Joy. There's no downtime. You come in for a half an hour to an hour, about an hour, I guess, and you're out the door and you can do whatever you want the rest of the day.
So I want to talk to you two about the actual, like what questions you get. But before we get there, Doctor, how do we know if this is something that would help us? How do you kind of qualify someone as this would be something that you would benefit from? So the women out there that are watching, what kind of symptoms would maybe be the perfect person that this could help?
So the most simple situation is after children or with aging, there's issues with dryness. They call it a mom bladder or a leaky bladder, tightness or laxity or external appearance. Those are most of the issues.
Those are the issues. And do you find that women feel embarrassed to talk about those kind of things? I mean, that's the other issue, is that you've got to, ask your doctor about this kind of thing.
Actually, not as much as you would think. We started asking this on a questionnaire and at evening events, and it comes up readily. This is all over the internet. You can go to Real Self. You can go to lots of places. It's on my website, of course. There's whole areas on the web devoted to this.
Okay, so
But this is the non-surgical side.
So this is CraigColvilleMD.com, just to mention that while we're talking about it. So for the most part, women are asking about this. They have a concern about it. You've seen that it's something that's top of mind when you're talking to potential patients about what they're concerned about.
We mix this into the discussion. Really, it comes up, but it comes into the discussion of people that have had babies. They're in for a little tune-up. They're talking about their abdomen or their tummy. They're talking about their breasts. They're talking about everything now. So we talk about a global approach, not just coming in, checking one thing, but basically everything that's on their mind. Will help them make a list.
Okay. And so now, Leslie and Joy, you guys are with the patients. What kind of questions do you because sometimes it's harder to ask the doctor, but if I sit with you, I can say, Leslie, I want to talk to you.
Now, it's very often I'm in the room with the doctor and someone's in for any procedure, breast augmentation, whatever. And I've actually had people then ask me after he walks out of the room, and they're like, do you do vaginal rejuvenation?
Okay.
It's like, I didn't want to ask when he was in here, but, I wondered.
Feel comfortable, right.
And, so that's really how we came about. It's like, okay, we've been having so many questions about this. Researched it quite a bit. And then we chose ThermiVa, which is what we use.
That's the actual.
That's the actual machine. That's right. It is a radio frequency device. As he said, there's no downtime with it. That's the great thing about it. Women can come in, they have the treatment, they go home, they can have sex that night. Anything. There's nothing. Yeah, I mean, exactly. A lot of the surgical procedures are 7-8 weeks, where they're having to avoid things.
Right.
We have had women who are so pleased with this because they've had painful intercourse, and this has changed their lives.
Well, that's what we're talking about. Some of the things when we talk about with plastic surgery or cosmetic surgery are aesthetic. They are, this looks a certain way, I'd like it to look another way. But this really is much more about a lifestyle, quality of life, that they feel they can have an improvement after having the ThermiVa.
In some cases, yes. Some women, it's an aesthetic.
Sure.
You know, they say, well, I don't have these other issues.
But this is
it's kind of a good bonus, though, for some of the other things that it does. But, you know, they're there for the aesthetic, the appearance of it. And others are wanting increased lubrication, just because they're having, you know, some people, women who are going through menopause, sometimes it's a medication that could be causing dryness or issues, and you know,
that's
it's
what
just
you're handling with this.
It just takes care of that.
So how about you? What's the you know, what kind of things are you handling with the women? What kind of things, you know, do you want to make sure they know, you know, before they come in?
So yeah, I mean, I mostly do skincare, but yeah, when I'm in the room, women open up and talk about all kinds of things.
Sure.
So yeah, it also helps with mild incontinence. So, you know, women that have to cross their legs when they sneeze.
Right. God forbid you sneeze without prior warning.
Right.
You know what I'm talking about.
Yeah.
Okay, so but I mean it's so we laugh and stuff and we're can we talk about this, but women have these issues and it's not fair that we shouldn't be able to ask our doctor or there shouldn't be products for us. I mean, Viagra's been on the market for 30 years.
Right, and it does help to increase libido and intensify orgasms.
Right, and these things are things that women are supposed to not talk about, and medical science is sort of lagging when it comes to, hey, women have these questions, but you know, Viagra, like I said, we've had that for 30 years. So we want to make sure that all the things that women are concerned about and want from medical science are there for us. So the first step, if someone's watching this, Dr. Colville, what's the first step? They should maybe go to the website. Talk about the first step for them.
The simplest thing to do would be to just go to the website. You can go to the website. There's a little bit of information there. We actually have some other information and some video information there. I'm in a group of plastic surgeons in the United States, part of the Plastic Surgery Channel. It's a video channel. It's online. There's more information there. But in the website, you can watch some video. You can learn about this. There's a contact form where confidentially you can just at 2 a.m. or 10 o'clock at night, you can contact the office, talk to our patient care coordinator, who will get back to the person in an email or telephone format, whatever they prefer, and talk to them and help them schedule an appointment. They can come see me, they can come in and see Leslie. And one thing about the machine, just since we didn't really talk about it, the machine is basically a radio frequency. So there's a warm sensation. That's about it.
That's as far as how
But the energy that's used is radio frequency. There's a couple devices on the market. Some are more of a laser, some have downtime, some are only internal, some are, but this is internal, external.
And there's the procedure itself is fairly comfortable, not, you know,
it's not painful at all.
Okay.
Not painful at all.
So the best thing, again, go to your website, CraigColvilleMD.com. We will link with that. Also, you're looking at it right there. We will link with that when we put this segment online, which it'll be on the full plate segment of 13ABC. So we will have that for you so you can take that first step, his phone number, the contact form, videos, so that you can kind of take a look and see, is this something that is for you? All of that is right there. Thank you so much, Doctor. Thank you so much, Joy and Leslie. I appreciate it. All right, when we come back, we're going to talk a little bit about an event that if you got engaged this summer or your daughter did, you need to come to this event. Stay with us.